cuboid syndrome. This is the foot, this is the lateral aspect of the foot, and you see this is the fifth metatarsal bone, the fourth metatarsal bone, the cuboid is over here. It's got articulation with the base of the fourth and the fifth metatarsal metatarsals, the fifth and the fourth, anteriorly. Posteriorly, he got articulation with the calcaneus bone, and you see the cuboid over here. Your patient, he will come to the clinic complaining of pain on this area. In general, he will tell you the pains over here. From the history, the medical history and the injury history which you take, it's not a trauma, it's nothing happens suddenly, it's overuse injury. And this is the cuboid. Why we have this cuboid syndrome? You have two muscles acting in the foot, like we call them stabilized muscle. The first one is the peroneal longus, is coming from the top of the leg, go behind the lateral malleolus and go underneath the cuboid. You see, this is the cuboid, there is a groove here, it goes underneath the cuboid, attach it to the base of the first metatarsal over here. This is the peroneal longus. Another muscles, the posterior tibialis muscles, came down behind the medial malleola, attach it to the navicular bone over here. What these two muscles does, when you walk and when you put your heel in the ground, the peroneal muscles get activated and pulling up. When it's pulled, it's pulling from here where the metatarsal head is, the first metatarsal, putting the foot to the ground. Now at this time, the posterior tibialis muscle activated and pull up from the navicular sag and rise the arch. For that we call them stabilized muscle, because they stabilize your foot, they're working together. What happened now? When the peroneal longus muscle get more exhausted and tired, pulling, trying to put the first metatarsal to the ground to pronate the foot, it put stress on the cuboid because it goes in this groove and pull the cuboid. When it's pulling the cuboid goes in inverted position like this. The cuboid is like this, it goes like that. And you see the medial aspect of the cuboid, it will be down like this. And this is what causes pain to your patient. To assess this and to check if the lateral pain in your patient foot caused by a cuboid or not, we do an assessment, we call it cuboid assessment. And the assessment, by securing the heel, putting the foot in neutral position, and now we try to dorsiflex. I'll stand up to see. We try to dorsiflex the fifth and the fourth metatarsal. We try to dorsiflex it. If there's free movement in dorsiflexion, the fifth metatarsal, that means the articulation between the fifth and the fourth metatarsal and the cuboid is good, and the cuboid is not related to your patient's symptoms. But if the cuboid's been everted, that means we lose the articulation between the cuboid and the fourth and the fifth metatarsal. And when we try to dorsiflex the fifth metatarsal, we start getting resistant. We can't dorsiflex it. That's telling us that the cuboid is not in its optimum position. To solve this problem, we need to use manipulation force to return back the cuboid to its optimum position. Or, if you are not familiar with mobilization and manipulation technique of the foot, we could use some exercise to manipulate this cuboid. We'll explain it more in our next video. Thank you.